in your body, this is the posterior segments of your lung. So you have, what we're going to learn about is, you see how there's a fissure right here, okay? So this is a separation of the lower lobe and the upper lobe. And then you can see that you have your lower lobe, and then you have an upper lobe, and then you have a middle lobe, okay? So we know that on one side there's 3 lobes, and on one side there's 2. This outside lining, if you look at this, this is a pleural lining, and you'll learn that there's 2 pleural linings. There's an inner pleural lining and an outer pleural lining. The inner pleural lining lines the lungs, and can you see it? Okay. And then the outer lining lines the thoracic cavity. So when you expand your chest and your diaphragm comes down and your intercostals and accessories go out, then the distance between the inner pleural space and the outer pleural space becomes negative. So what do you think that does to the inner pleural space, the lungs? It makes them want to pull out to where the outer pleural space is to make the pressure go from negative to being neutral. Okay? And so then when you relax, exhalation is passive. So then when you relax, your diaphragm comes back up, your intercostal space is decreased, and your accessories, your chest comes down. So that compresses the lungs. So what wants to happen to the air inside the lung? It wants to go out. Right? So what stops the air from going out? When you take a deep breath in, you go. So what's stopping the air from coming out? You actually close your glottis, and that's a structure that we'll learn about, and that stops the air from coming out.